ASU has a brand new medical school, and first classes are already underway. The new John Shufeldt School of Medicine and Medical Engineering focuses on the development of physician engineers. Dr. Holly Lisenby is dean of the new medical school, and she joins us now. Welcome to Arizona Horizon.
Thank you for having me. I'm delighted to be here.
Well, we're good to have you here, too. We've talked a little bit about this with other folks along the way. This is not a traditional medical school, correct?
That's right. We are reimagining medical education for the future, acknowledging that new developments in technology can really transform what's possible. And so we have fully integrated next generation technologies, artificial intelligence, and so on, into not only what we teach, but how we teach it.
And the goal is to get physician engineers graduated and out there doing things. How would you describe a physician engineer?
A problem solver. Someone who looks at some of the problems that exist in healthcare today and doesn't say, well, that's just the way we've always done it, but rather says, let's work on a solution to this problem. And that solution might be a new medical device, a new piece of software. It might be a redesign of the system itself. And so someone who can really not just practice medicine, but transform the practice of medicine by leveraging their engineering training.
You say not just practice medicine. Will these graduates be able to practice medicine? I mean, will they be able to treat things as opposed to come up with new ideas?
Absolutely. In 4 years, our students will be receiving both the MD, so the medical degree, as well as the Master's in Medical Engineering. And then after that, they'll be prepared to do residencies in order to be able to practice medicine.
Yes, so it's a kind of a medical engineering school.
That's why our name is so long. We're the John Shufeldt School of Medicine and Medical Engineering.
Yeah, I was going to say, you're involved with ASU. All ASU names are long. That's the way that seems to work. Collaborating across fields at ASU, what's that all about?
So one of the design principles at ASU is fusion across the disciplines, and we're certainly bringing together the fundamental medical sciences, the clinical sciences, along with all sorts of engineering, not just computer science, electrical engineering, biomedical engineering, but also the humanities. The humanities are a really important part because medicine is fundamentally a human endeavor, and so we want our physician engineers to understand how to use these technologies to serve humanity and take care of Arizonans.
Collaborations with the city of Phoenix, with Honor Health, others?
Absolutely. So I want to give a big shout out to Mayor Kate Gallego and the investment that the city of Phoenix and the council members have made our new ASU Health headquarters building possible, which is going to be situated right here in downtown Phoenix. Of course, support from the Arizona Board of Regents, and the governor has been critical. The Phoenix VA is one of our partners. Phoenix Children's Hospital, but Honor Health is our primary clinical affiliate.
And it's time frame for the new building, new construction, do you have that?
Somewhere in 2028. But we've already gotten started here in downtown Phoenix in the Mercado building, and our students they were just in class today. This is their fourth week in class.
I was going to say fourth week in class.
Yes.
How does that work? Because school hasn't started at ASU yet, but these folks are already underway.
Welcome to my world. So in the field of medicine, it's a 12-month-a-year school, and our students started their orientation July 27th, and then the first week of classes formally was August 3rd, starting with our Becoming a Physician Engineer class.
Wow, that's a good place to start. How many students?
We have 36 students.
And will that grow in years to come, or is that kind of where you want to, that's a magic spot?
We plan to grow over time, but we're starting with 36 as we're building the school together. About half of our students actually are from Arizona, and we're really thrilled about their commitment to improving health outcomes here in the state.
Tell me more about these students. How are they selected? How do they apply? How are they selected? Age demos, what do you got?
So they apply through the standard process for all medical schools in the United States, but what we looked for in the application and in their essays and interviews is why did they want to do this unique training at the convergence of medicine and engineering. We also asked them about their commitment to improving health outcomes in Arizona. So of our 36 students, not all of them are engineers. Certainly many of them did major in STEM, but some majored in humanities and other areas of science. So it's a really nice diversity in terms of the disciplines represented. They hail from 11 different states across the country, and as I said, half of them call Arizona home.
Is there a program to ensure that they may have come from other places, but they're here now, and we need them here in this state after they graduate? Is there a way, is there any kind of incentive there? Is that something that you haven't worked on yet?
Well, a big part of our focus is on the training that they're going to be receiving in Honor Health and our other clinical affiliates. And as you may know, Honor Health is a 9-hospital health system which is locally owned and operated, and they operate a large number of primary care settings across the city and across rural areas as well. And so the hope is that being exposed to those needs, that those students many of them will choose to stay and do their residencies here in Arizona at Honor Health or some of the other residencies in the area, and really invest in developing solutions that will benefit the leading health challenges in Arizona.
A personal question here. You're the dean of the school here. What attracted you to all this, and did you think that your career would wind up as, you know, developing physician engineers?
Well, throughout my career as a researcher and as a clinician, I've focused on using devices to improve brain health. So my field is the field of neuromodulation. And so across my career, I've always collaborated with engineers because they're important team members when you develop new devices. And when I learned that ASU was starting this entirely unique model of education, I thought if I had it to do over again, I would have applied to this school. And so it's been really the honor of my professional career to have been invited to be the founding dean and really help build this school with an amazing team.
I was going to say, did you see some Holly Lisenbys there among the students?
Well, I have to brag. Our students are outstanding. They truly are pioneers, innovators. They're so brilliant and bring so much passion. It's just been a thrill to work with them.
It's the ASU John Shufeldt School of Medicine, and you are the dean, Holly Lisenby. And thank you so much for joining us. We really appreciate it.
Thank you for having me.
You bet.